All here at the World Health Assembly. We are honored to welcome you to our official side event, Bridging Health and Peace, Accelerating the Global Health and Peace Initiative in Turbulent Times. We look forward to exploring practical approaches to implementing the Health and Peace Initiative through strengthening health systems. Around the world, conflict is increasingly driving humanitarian crises, displacement, destruction of health systems, food insecurity, and widening health insecurity. Health workers and civilians are too often placed at risk, while access to essential care becomes disrupted for millions. At the same time, health also can serve as a bridge for dialogue, trust, and community resilience. Primary healthcare, protection of health services, and equitable access to care are not only humanitarian priorities, they are foundations for stability, dignity, and peace. Today's discussion brings together perspectives on how the global health community can work across sectors to protect health in conflict settings, strengthen resilient systems, and promote peace through solidarity, equity, and people-centered care. We will hear a WHO technical update from Mr. Guillaume Simonian, Unit Head for Humanitarian Policy and Coordination, followed by statements from member states in Oman, Spain, Brazil, and Slovenia. In addition, we will hear health system updates from WONCA, the World Organization of Family Doctors, the World Federation of Public Health Associations, the International Council of Nurses, and a sobering report from the London School of Hygiene and Tropical Medicine from Professor Sir Andrew Haynes. So we'll start at this time with our WHO technical update. Mr. Guillaume Simonian.
Thank you, Dr. Kim. Honorable Ministers, Your Excellencies, distinguished delegates, dear colleagues. So first of all, allow me to begin by expressing sincere appreciation to the co-organizers of this event, the World Federation of Public Health Association, the World Organization of Family Doctors, the co-champions of the GHPI, the Sultanate of Oman and Switzerland, and the co-sponsors of this event, Brazil, Spain, and Slovenia. Thank you. Today, we live turbulent geopolitical landscapes, but in these times, health is more than ever one of the remaining foundations for peace and security. Accessible, affordable, inclusive health systems, they are the backbones of universal health coverage that we know. But they're also essential to the trust of citizens towards their governments. Health does not only contribute, but it is also necessary to social cohesion and resilience. Impressions that our loved ones don't get the healthcare they need, they are distrust zones in the feet of any government around the world. And at the same time, the good feeling of health systems doing everything possible in the context for our loved ones who are needing care, they generate powerful and long-lasting trust into public institutions. When we have active or frozen conflicts, and when these are breaking all communications across the front line, health, oftentimes, remains common to both sides. Belligerents can often accept mediated efforts to solve health issues. At the same time, the promotion of mental and physical well-being in sometimes fractured or tense communities has a tendency to create a neutral opportunity for dialogue, for hearing, and for solving grievances, and ultimately to promote inclusion and peace. When the health systems function well, health reduces grievances. It mitigates polarization. it creates opportunities for dialogue. That's why we are here. It is a solid seed for peace to take root and to bloom. In May 2024, the World Health Assembly consensually adopted the resolution 77.9, establishing our mandate for the Global Health and Peace Initiative. And I insist here on the consensual nature of this resolution. During the negotiations, and our Swiss and Omani colleagues lived through that, there were lots of questions. There were some concerns raised. Peace in a conflictual world can become political. But when it is matched with health, it can become consensual. The co-champions at the time worked with all member states to understand and to cover all questions, to answer to all concerns. And at the end, a consensus could be reached. And this is remarkable. That's why we are here today. This resolution highlighted 4 areas of work for WHO and for its member states. One is evidence on health and peace. 2 is to communicate, to raise awareness. 3 is to build capacity. And 4 is to ensure dialogue and partnership. Since this resolution, since the last 2 years, WHO has worked very hard to implement this mandate and to be worthy of the consensual directions that the member states have put on us. We have continued to generate evidence and to refine the WHO operational tools. We have expanded capacity building efforts and we have strengthened our partnerships. I will provide a short summary of where we stand at this stage. In terms of evidence gathering, we are continuing to support WHO country programs to build a rigorous evidence base. That includes days of tranquility during active conflicts to negotiate access for health purposes. It includes how health services in some places have reduced intercommunal tensions. It includes how mental health in other contexts have been strengthening to contribute to violence reduction. We are thankful to, in particular, the UN Peacebuilding Fund of the UN Secretary General for its support in several complex contexts, in Burkina Faso, in Cameroon, in Guinea-Bissau, in Haiti, in Liberia, in Somalia, also in Sri Lanka. In all of these country programs, we have managed to gather very practical evidence on how health can support peace. In other contexts, regular WHO programs have also contributed to peace and social cohesion. In Afghanistan, in Bangladesh, in Bulgaria, in Haiti, in Mali, in South Sudan, in Syria, in Ukraine. We have managed to negotiate access for disease control. We have managed to promote equitable health access. We have even sensitized police forces to specific health issues. We have managed relationship between host communities and refugees around health access. We have managed to keep trust in complicated health reforms in war contexts. And we have managed to provide the mental health and rehabilitation care that people needed. All of this contributed to social cohesion and peace. We are now learning from this body of evidence, and we are working on this basis to design an operational framework that we can build upon for the GHPI. On communication and awareness raising, we engage continuously with member states, with UN partners, with health actors, with civil society, with academic institutions, to deepen the understanding of how the health sector can contribute to peace outcomes. We are working to raise awareness across regions, across sectors, to ensure that our approach remains technical, neutral, context-specific, evidence-based, and aligned with our mandate. Specific efforts have been ongoing at the global level, including at the UN General Assembly, but also by all of the WHO regional offices, in particular in Africa, thanks to the support by Switzerland for this specific region. We are building capacity. Training curricula are being developed on conflict analysis, on do no harm principles, to design health programs that generate peace dividends for different target groups, both health professionals, but also diplomats. We are working with WHO collaborating centers, such as the China Foreign Affairs University, the Louvain University, the University of Geneva, the Hospital of Geneva, with partner institutions like the Omani Diplomatic Institute, like Swiss Peace, like Basel TPH, to develop specific health and peace courses, which we hope will bloom and provide further capacity across contexts across the globe. On dialogues and partnership, I cannot stress enough how Switzerland and Oman are playing a pivotal role in convening member states, in facilitating consensus, and in ensuring that diverse perspectives across the globe are informing our roadmap. I would also like to take the opportunity to express our sincere appreciation for their sustained engagement and leadership. The roadmap of the GHPI is a living document, and we welcome further dialogue across member states to strengthen it going forward. It is therefore very engaging and encouraging to see more countries expressing interest. The expanded engagement is a reminder that health and peace is pertinent in countries affected by conflicts, but also elsewhere to deepen social cohesion. We'd like to thank Brazil as a co-sponsor for this event. You have long been a champion of multilateralism, and at home you have worked towards including universal health coverage through the Sistema Único de Saúde, Maus Médicos, Bolsa Familia programs. All of these are really illustrating how at home you value social protection and health equity to reinforce social cohesion. In Kenya, also who supported the organization of this event, the co-leading of the Global Group of Friends for Refugees on health inclusion, and the leading by example at home on progressive inclusion of refugees into national health system and national health insurance mechanisms. Spain has been always a very principled member state, showing very strong leadership to prevent attacks on healthcare, which is a growing phenomenon that we live through now, and also showing the world recently how a very inclusive approach to international health regulations can be implemented, including during this current hantavirus outbreak. Slovenia has also long contributed to people-centered health system and mental health reforms, and also continuously promoting health and peace as a viable approach to neutral, effective diplomacy and peace promotion. And we see health and peace often recurring at the Bled Strategic Forum, and thank you for that. We are partnering with other institutions like the International Peace Institute, Humanitarian Dialogues, Interpeace, with specific peace building and mediation efforts to infuse into WHO programs, with Peace Invest to design investment cases and create innovative financing opportunities, with ongoing efforts in Togo and Benin, for instance. To close, I would like to say that WHO is very pleased that the Global Health and Peace Initiative remains firmly driven by member states, with solid evidence being gathered, supported by a growing number of partnerships, and now solidly anchored in practice. Our next task is to further scale up implementation and to ensure that the health and peace approach becomes standard practice for the WHO and for other health actors in fragile, conflict-affected, vulnerable settings and elsewhere as relevant. We are in a world that sometimes is getting fragmented, but the health sector has a unique power to get us together, to convene, to build bridges, and to strengthen social cohesion. What we need now is very simple: continuous engagement by member states and partners, and institutional and financial support to many efforts that are ongoing at country level. If anything, the recent hantavirus crisis has reminded us all, as Dr. Tedros introduced in this assembly, that when it comes to public health, we are all in the same boat. There can be no health without peace, no peace without health. If we spread health, we will seed trust, and eventually we will build peace. Thank you.
Thank you so much. So timely and so appropriate for the times that we're in. Thank you. Next, we will be hearing from Oman and from the Sultanate of Oman. We have a video. Dr. Abdullah Hamoud Al-Hati, the Undersecretary of the Ministry of Social Development, for the affairs of persons with disabilities will speak from the Sultanate of Oman.
Distinguished guests, colleagues, and friends, we meet at a time when the global landscape is fractured by conflict, systemic mistrust, and escalating crises. In such turbulent times, we are often forced to choose between immediate humanitarian relief and long-term development. But today, I want to talk about a framework that bridges this divide, an idea that recognizes that health and peace are not separate goals, but two sides of the same coin. Simply put, there can be no sustainable development without health, and there can be no permanent health gains without peace. This is the core of the Global Health and Peace Initiative. It is rooted in the fundamental truth that health programs, when designed with conflict sensitivity, can actually reduce social friction, build community resilience, and open doors for dialogue, where diplomacy alone has stalled. Healthcare workers are uniquely trusted. Health itself is a politically neutral space. That neutrality is our greatest untapped bridge to peace. For the Sultanate of Oman, this is not a new concept. It is part of our diplomatic DNA. Oman has long been recognized as a global facilitator for peace, a bridge builder, and a sanctuary for quiet, constructive dialogue. It is of no coincidence that in late 2019, it was the Sultanate of Oman, alongside Switzerland, that co-launched the early stages of this very initiative with the WHO. But as the GHPI transitions from a global policy framework and a formal WHO resolution into real-world action, we must ask ourselves, how do we operationalize this approach right here on the ground? How do we take Oman's historic role as a political mediator and turn it into a practical public health methodology? The answer lies in two parallel tracks. First, strengthening our internal health systems, and second, in maximizing the power of the WHO collaborating centers. First, we must view health system strengthening through a peace-responsive lens. When Oman builds robust, resilient primary health care, we are not just delivering medicine, we are building equity. By training our healthcare workforce, from doctors to policy planners, to practice health diplomacy, we ensure that health delivery actively fosters social cohesion and inclusivity. Second, we must leverage the incredible asset of the WHO collaborating centers. Oman already boasts world-class institutions designated by the WHO, including our central public health laboratories for emerging infectious diseases and our programs in chronic respiratory illness. These centers are more than just local facilities. They are regional hubs of excellence. To accelerate the Health and Peace Initiative, we can expand this model in three ways. One, regional knowledge exchanges. We use Oman's existing collaborating centers to train health professionals from fragile or conflict-afflicted neighboring states, building technical equity and trust across borders. Second, a dedicated hub for health diplomacy. We should actively explore the designation of a specific institutional branch or partner within Oman, such as working alongside the Oman Medical Specialty Board or the Diplomatic Academy to become a recognized center for global health, security, and peace. Third, evidence generation. This center would specialize in collecting data, documenting case studies, and creating the operational frameworks that prove exactly how a health intervention can de-escalate regional tensions. Excellencies, colleagues, the world is changing rapidly. and traditional silos will no longer save us. We cannot afford to treat health as merely a technical specialty and peace as a political luxury. Let us use Oman's trusted neutrality, our resilient health infrastructure, and the global network of WHO collaborating centers to turn the Health and Peace Initiative from a visionary document into a tangible reality. Let us prove to the world that when we heal people, we can begin to heal nations. I thank you, and I wish you all the best.
Thank you so much. And I do want to recognize that we have guests from Oman here. Thank you so much, Dr. Hani, and those who are with us. Thank you. At this time, I'd like to welcome Professor Felipe Proenço, the Deputy Minister for the Health and Labor Management and Education Department in Brazil. Thank you so much for being here. I will also announce that we will have translation, so please do use your translation for the next part. Thank you so much.
Thank you, Kim. And I will speak in Portuguese, so yeah, it's possible to need the translation. Senhoras e senhores, quando falamos em tempos turbulentos, referimos-nos a guerras e conflitos que fragilizam todo o sistema internacional, bem como a países que enfrentam crises humanitárias complexas, onde milhões de pessoas vivem como refugiadas ou deslocadas internamente, em condições extremamente vulneráveis. Nos conflitos recentes, diversas agências das Nações Unidas, própria Agência para Refugiados, Programa Mundial de Alimentos e UNICEF têm enfrentado severas restrições operacionais, bloqueios logísticos e até ataques diretos, que limitaram drasticamente sua capacidade de prestar assistência humanitária efetiva. Em Gaza, por exemplo, comboios foram impedidos de entrar, trabalhadores de saúde foram mortos e a ajuda distribuída permaneceu amplamente insuficiente diante de um cenário de fome generalizada. Nesse cenário, a saúde global, promovida também pelos trabalhadores de saúde, emerge não apenas como um direito fundamental, mas como um instrumento estratégico para a promoção da paz. Assim, defender a saúde universal e a sua atuação é defender o princípio da humanidade. No Brasil, o Sistema Único de Saúde, o SUS, é um sistema universal que atende a todas as brasileiras e brasileiros, cidadãos fronteiriços, migrantes e refugiados. Com isso, o Sistema Único de Saúde traz uma perspectiva verdadeira de atendimento universal, integral e equânime de saúde, ajudando a promover a estabilidade nacional e regional na América do Sul. Como exemplo atual, é a atuação diante da crise migratória proveniente da Venezuela, onde o Brasil tem demonstrado, especialmente em regiões de fronteira, um compromisso contínuo com a dignidade humana. Quem buscar atendimento em território brasileiro encontrará no Sistema Único de Saúde acolhimento e cuidado. No âmbito do Mercado Comum do Sul, o Mercosul, e da União de Nações Sul-Americanas, a Unasul, o debate sobre trabalhadoras e trabalhadores da saúde tem avançado como eixo estratégico para a integração regional, com foco na harmonização de critérios de formação, no reconhecimento de diplomas e na mobilidade laboral, especialmente em regiões de fronteira e áreas com escassez de trabalhadores. Além disso, o Brasil vem construindo seu protagonismo através da defesa de uma integração solidária que priorize o acesso universal e a redução das desigualdades, em um cenário marcado por assimetrias econômicas e políticas entre os Estados-membros. Cabe destacar que a promoção da equidade em saúde e da igualdade de gênero passa, de forma decisiva, pelo fortalecimento da educação na saúde e da gestão do trabalho. Campos historicamente compostos majoritariamente por mulheres trabalhadoras e nem sempre devidamente valorizados. A ampliação de investimentos nessas áreas não apenas corrige desigualdades estruturais, como também impulsiona inclusão social, justiça distributiva e desenvolvimento sustentável em escala global, ao reconhecer e valorizar o papel central dessas trabalhadoras na sustentação dos sistemas de saúde. Assim, reafirmamos diante de vocês que a defesa da saúde pública e da democracia são inegociáveis. Não existe paz sem democracia. Não há paz onde não há acesso à saúde. Não há estabilidade onde sistemas de saúde colapsam. E não há reconstrução possível sem trabalhadores da saúde protegidos e valorizados. A experiência recente do Brasil evidencia de forma contundente como decisões políticas impactam diretamente na saúde da população. Durante um governo anterior no Brasil, negacionista, o país registrou o segundo maior número de óbitos por Covid-19 no mundo, reflexo de escolhas deliberadas que fragilizaram a resposta à pandemia pelo SUS. Por outro lado, o atual governo do presidente Luiz Inácio Lula da Silva tem avançado na reconstrução de políticas públicas de saúde, estabelecendo uma agenda voltada à valorização da atenção primária à saúde, à formação de médicos especialistas, com o objetivo de ampliar os atendimentos para reduzir filas de espera por atenção especializada e reafirmar o princípio da universalidade do Sistema Único de Saúde. Senhoras e senhores, a saúde global não é apenas uma agenda técnica, é uma agenda política, ética, civilizatória e democrática. Promover a saúde é promover a paz. Proteger trabalhadores de saúde é proteger a esperança, pois estes trabalhadores são verdadeiros agentes promotores da harmonia entre os povos. Fortalecer sistemas universais é fortalecer democracias. E, acima de tudo, cooperar internacionalmente é reconhecer que, em um mundo interdependente, ou avançamos juntos ou falharemos juntos. Por fim, gostaria de agradecer, enquanto médico de família e comunidade e professor de saúde pública que sou, o convite da Organização Mundial de Médicos de Família e também da Federação Mundial de Associações de Saúde Pública para participação nesse seminário. O Brasil tem muito orgulho de fazer parte dessa iniciativa. Muito obrigado.
Thank you so much, Professor Felipe Proenzo. And, we are so proud to sit here as fellow family doctors together with you. It is truly a joy and a pleasure. Thank you so much. Next, we are going to hear from Spain and Dr. Javier Padilla, the Secretary of State for Health, the Ministry of Health of the Spanish government, by video.
Hello, everybody. I would have liked to be there in the side event, but unfortunately it has not been possible. So I'm very grateful for the possibility of being at least on this video. I think that when we are talking about peace and health, we are really talking about what gives the possibility condition for health to be developed. When talking about health, we should be really conscious that when we are focusing on social determinants of health, the social stability and the absence of war situations is one of the main determinants for health that should be assured. One of the things that I think that we should outline and reinforce is the need for keeping and maintaining the healthcare assistance for people who live in places in war situation. for people who are living right now in places like Iran, or in places where genocides are being held, like Palestine or whatever. The possibility of having proper access to healthcare and the need for healthcare facilities not to be pointed as objectives for war is one of the things that should be guaranteed when talking about the relationship between health and peace. This for the places where war is taking place, but also member states should be really conscious of the need for guaranteeing the healthcare access, the healthcare right and the healthcare access for refugees, asylum seekers, and immigrants in general for healthcare assistance. I think that right now in many countries are discussing about the possibility of not of excluding or including undocumented migrants, asylum seekers, or refugees for healthcare assistance, and reinforcing not just the entitlement, but also the actual access. For us, for Spain, this is something that we cannot look apart. We should really get responsibility of giving whole right, whole entitlement, and whole access for everybody who is living in our countries, but very especially for people who are moving away from countries where war is an actual reality, and who may need medical assistance. In addition, it's not just the usual medical assistance, but also the need to be enrolled as a country in all these operations and programs, together with institutions such as World Health Organization, to get some of these people with special medical needs to our countries to reinforce this medical care that they may need. I think that it's really important that in a place like the World Health Assembly, in a moment like the one we are living in a city like Geneva, the house of multilateralism, an event that talks about health and peace is being held. And I want to thank again to the organizer by bringing a topic like that in a moment like this. Thank you very much, and I hope that this is a very fruitful event, and that we get to engage and to get concrete commitments as member states to promote the healthcare assistance in situations where peace is not achieved, but people need medical care. Thank you very much.
And again, I want to recognize those in the room who are from Spain. So thank you so much for being here, and maybe some others in the room, if you're here, please wave. Next, we will be hearing from Slovenia, from Dr. Jana Lesjak, our Deputy Ambassador of Slovenia. Thank you so much.
Thank you, moderator, for giving me the floor, and thank you, dear organizers and other co-sponsors for this very, very important and fruitful discussion so far. Indeed, we are in the same boat, all of us, and it is the challenge of bridging the political and technical. And we are committed to go forward with that agenda. And let me assure you that Slovenia aligns itself very strongly with the premise that there can be no health without peace, and no peace without health. In today's global context, which is unfortunately marked by global conflicts, deepening humanitarian crisis, and also climate-related insecurity and attacks on healthcare, the link between resilient health system and sustainable peace has become impossible to ignore. As a small country, Slovenia is very committed to multilateralism and prevention, and also to human rights. And we consider the WHO Global Health and Peace Initiative as a very important operational bridge between humanitarian response, also development cooperation, and sustainable peace efforts. Also, the WHA resolution 77.9 adopted in 24 provides a very valuable framework for us, and we particularly welcome the emphasis on strengthening evidence-based approach, capacity building, partnerships, conflict-sensitive health programming, and also full respect for international humanitarian law. As you know, Slovenia has been extremely vocal on the international humanitarian law also during our membership in the Security Council. And we are currently a member of the Human Rights Council, and humanitarian law is on the top of our agenda. I don't want to be too broad in our priorities, but let me outline 4 of them so you can get the picture of where we are heading with regards to the GHPI roadmap. So first of all, as I mentioned, protection of healthcare and civilians. We are underlining in all forums that healthcare must never become a target, never. And we strongly have reaffirmed that the importance of compliance with the law and support that WHO mandates have also under the resolution of 65.20 regarding health emergencies in humanitarian crisis. Protecting healthcare infrastructure is not only a humanitarian imperative, it is also essential for preserving trust and social cohesion and prospects for long-term recovery and peace. Secondly, health systems are platforms for trust and inclusion. So inclusive and accessible public health system can help reduce fragility and polarization. Third, as I mentioned, human rights-based approach and prevention-oriented approaches. That is extremely important for my country. And because Slovenia believes that health and peace efforts must remain firmly grounded in human rights, also in dignity and equality amongst us. This includes equitable access to healthcare, protection of vulnerable groups, gender-responsive approach, and meaningful participation of local communities. Fourth, as I mentioned, strengthening the multilateral cooperation. Without the multilateralism, we are lost. We are like in a chaos that is visible to our eyes, and we really need it as an anchor to build togetherness, to build connectivity, and as I mentioned, to build trust. So in these turbulent geopolitical times, we should resist fragmentation by all means, and instead strengthen cooperation between WHO, between member states, and also civil society and local actors in the field, and of course, humanitarian partners. Let me conclude that Slovenia remains committed to advancing health and peace agenda together with WHO and all the partners. And we encourage continued political engagement by all and sustaining also sustainable financing for implementation of the roadmap, including practical tools for mainstreaming conflict-sensitive approaches across WHO programming. I thank you for your attention, and I'm excited to hear more during this discussion. Thank you.
Thank you so much. We've heard so much from our speakers so far, but we are moving now to a section where we'll be hearing from health systems and different organizations. And so we will start with WONCA. And health system perspective from WONCA, the World Organization of Family Doctors, Professor Viviana Martinez Bianchi, WONCA President.
Thank you, Kim. Honorable ministers, distinguished delegates, colleagues, and friends. On behalf of the World Organization of Family Doctors in 140 countries and territories, I want to thank you for joining us in this dialogue, in this conversation on bridging health and peace, accelerating the GHPI in turbulent times. The adoption of resolution WHA 77.9 was an important moment because it reaffirmed a foundational principle from the WHO Constitution, that the health of all peoples is fundamental to the attainment of peace and security. From a WONCA perspective, peace is the foundation of health. And where peace is fragile or absent, primary health care helps people hold on to dignity, continuity, trust, and essential care. This is why accelerating the Global Health and Peace Initiative is so important now from the perspective of WONCA. The world is facing overlapping crises: armed conflicts, humanitarian emergencies, forced displacement, climate-related disasters, pandemics, economic instability, and widening inequities. Multilateralism at risk. A family doctor in almost any conflict-affected setting could tell us a version of the story. A mother arrives with her children after being displaced. One child has missed vaccines. Her father has run out of blood pressure medicine. She has not slept. She is grieving the death of her husband, frightened and unsure where her family will be next week. She's not asking for an abstract discussion about health systems. She's asking, can someone help my family today? Can you help me today? Millions of people are experiencing interruptions in immunization, in maternal care, in chronic disease management, in mental health support, and access to essential medicines because of instability and conflict. At the same time, health can also serve as a bridge for dialogue, trust, and community resilience. Primary health care, protection of health services, and equitable access to care are not only humanitarian priorities, they are also foundations for stability, dignity, social cohesion, and peace, as Guillaume mentioned earlier. To help people survive conflict, we must protect and strengthen the everyday health services that they depend on. This means keeping clinics safe, protecting health workers and health facilities, and ensuring access to essential medicines, ensuring access to mental health support, maternal care, immunization, chronic disease management, community-based services, even in the most fragile settings. It also means supporting the multidisciplinary primary healthcare teams who sustain communities every day: family doctors, nurses, midwives, community health workers, pharmacists, mental health professionals, social workers, and public health professionals. Primary healthcare is a practical delivery platform for the Global Health and Peace Initiative. The GHPI becomes real not only through resolutions, but through how people experience health and healthcare. It lives in whether a family can reach a clinic safely, where they are treated with dignity, whether displaced communities receive continuity of care, whether all communities are served fairly, whether immigrants have rights to access healthcare, and whether health workers are protected and trusted. In family medicine, health becomes a vehicle for peace through several interconnected pathways. Through trauma-informed care, family doctors help heal interpersonal violence and break cycles of trauma. Through care for refugees and displaced populations, we help rebuild trust and continuity after conflict, arriving to a place where you can feel you're loved. By addressing poverty, food insecurity, discrimination, and other social determinants of health, primary care also addresses some of the root causes of instability and social conflict. At the systems level, family medicine has long embraced social accountability and health equity as core professional values, recognizing that reducing inequities is inseparable from promoting social cohesion and peace. And every day, through listening, culturally humble communication, conflict resolution, and relationship-centered care, family doctors model the human trust and dialogue that peaceful societies depend upon. In this way, primary healthcare does not only respond to the consequences of conflict, it also helps strengthen the conditions for dignity, resilience, stability, and peace. From a WONCA perspective, strengthening primary healthcare is not only essential for universal health coverage, it is also an investment in healthier and more peaceful communities. So our call today is clear: invest in primary healthcare, invest in primary care, in the clinic space where people are needing to be seen. Protect health workers and health facilities. Support equitable access to care in fragile and conflict-affected settings. Integrate mental health and psychosocial support into primary care. Address the social determinants that undermine both health and social stability, and include primary healthcare voices in the design and implementation of the Global Health and Peace Initiative. By anchoring peace in the everyday consultation room, we transform global strategy into a lived reality for people and communities across the world. Thank you. Thank you again for being here with us this evening.
Indeed, we are truly in this together. And when we think of, if I were to ask you, who of you have a family doctor? How many would put up their hands? Maybe I won't call on you to say so, but I would hope that one day, and maybe not too soon, you would all be able to raise your hands. Next, we'll be hearing from Professor Bettina Borish, who is the CEO of the World Federation of Public Health Associations. Bettina.
Excellencies, distinguished colleagues, friends, and fellow advocates for humanity. Thank you to all sponsors. Thank you to WHO. Thank you to everyone who comes and supports. I speak here as the CEO of the World Federation of Public Health Associations on the connection between health and peace. Our president, Professor Raman Bedi, would have loved to be with us and gives his excuses. Public health is often seen and described as vaccines, systems, surveillance systems, and scientific advances. But at its heart, public health is about something deeper: the conditions that allow human beings to live with dignity, safety, and hope. And none of these conditions can flourish without peace. Where there is war, disease follows. Where there is conflict, hunger grows. Where there is displacement, maternal mortality rises, children miss vaccinations, as you said, mental health deteriorates, trust in institution collapses. We are witnessing across many parts of the world today. Conflict is not only a political failure, it is a public health emergency. But peace is more, as we like to say, than the absence of war. Peace is the presence of justice, compassion, opportunity, and human connection. We know that public health begins where people live, love, and work, in home, schools, workplaces, communities. A child who grows up in fear cannot fully thrive. A mother living amid violence cannot achieve well-being. A community divided by hatred cannot achieve health equity. And increasingly, we are learning that emotional well-being, social connection, and human trust are not soft issues, but they are determinants of health. As public health professionals, we therefore have a responsibility not only to prevent disease, but to build societies that nurture peace. And that means tackling inequality. It means addressing misinformation and division. It means protecting vulnerable populations. It means listening across cultures and political differences. And it means recognizing our shared humanity. The challenges facing our world, pandemics, climate change, we will hear more, migration, antimicrobial resistance, non-communicable diseases cannot be solved by nations alone. They require solidarity. Public health has always been strongest when building bridges rather than walls, but we have tried with walls, didn't work. At the World Federation of Public Health Associations, we believe that health can be a pathway to peace. When communities work together to vaccinate children, to improve sanitation, to support mental health, or protect the environment, they create trust. And trust, as we heard, is the foundation of peaceful societies. Today, I want to leave you with this thought. Peace is not only the work of diplomats and politicians. Peace is also the work of nurses, community health workers, family doctors, researchers, teachers, faith leaders, and public health professionals. Every time we reduce suffering, promote fairness, or restore dignity, we are contributing to peace. And perhaps, even if we are at a World Health Assembly, true global peace begins not in conference halls, but in the human heart, expressed through compassion, service, and care for one another. I thank you.
Truly, so many sound bites from all of our speakers. I'm typing very fast here to try and capture and distill some of them, and I will share a little bit in a little moment. But thank you so much, Bettina. And we will move to our next speaker, who is Dr. Jose Luis Cobo Serrano from the International Council of Nurses, President of the International Council of Nurses.
Hello, everyone. On behalf of the International Council of Nurses and the 30 million nurses worldwide, let me thank you for this opportunity to represent the nursing profession in this important discussion on accelerating the global health and peace initiative. Advancing the health and peace initiative requires more than vision. It requires practical action to build a stronger, more resilient health systems. And at the heart of that effort are the frontline health professionals who deliver care in the most complex and fragile settings. Nurses are on the front lines of every health emergency, every conflict, and every humanitarian crisis. They sustain continuity of care, build trust within communities, and provide the stability that allows health systems to function, even when everything around them is breaking down. Their presence is not only a health intervention, it's a peace-building force. Yet rising attacks on healthcare in conflict are gravely concerning and must never be normalized. Through ICN's engagement and our ongoing Nurses for Peace campaign, we are sending a clear message. Nurses and other healthcare workers must be urgently protected. And the world must invest in nursing power as a cornerstone of global health security and peaceful, stable societies. Recent tragedies, from the antivirus concerns to the deaths of nursing during Ebola outbreaks in the DRC and Uganda remind us why health workers' safety must be at the center of the global health agenda. These events reinforce the urgent need for a prepared, protected, and resilient health workforce, and for the rapid finalization of the WHO pandemic agreement PS annex to ensure equitable access and resources in global emergencies. ICN strongly condemns all attacks on healthcare. Impunity perpetuates violence and fuels a devastating cycle of harm. When health professionals are attacked, ostracised, or punished for carrying out their ethical duties, it is not only a violence of law, it's an attack on humanity itself. Through our humanitarian work and the Nurses for Peace campaign, ICN is providing direct support and strong advocacy. ICN is working directly with National Nursing Association in countries facing the world's most severe conflicts. And just last week, we drew on our direct conversation with this association to submit inputs to inform the preparation of the report by the UN High Commissioner for Human Rights on the promotion and protection of the human rights of women and children in conflict. Our Nursing Leadership for Crisis Recovery and Resilience program, piloting Ukraine with 23 extraordinary nurses leaders, has demonstrated the power of investing in local leadership to strengthen systems, rebuild trust, and support recovery. This model is now ready to be adapted and expanded to other crisis-affected settings. Accelerating the Health and Peace initiative means investing in the people who hold health systems together. When we protect and empower nurses, we strengthen communities, reinforce stability, and lay the foundation for peace. Thank you very much.
Thank you so much. Next, we have our final speaker on our esteemed panel tonight is Professor Sir Andrew Haynes, who I learned actually went to the same medical school and did residency at King's College. Thank you for being here and representing the London School of Hygiene and Tropical Medicine. We'd welcome your thoughts.
Well, thanks so much for inviting me to say a few words. It's a particular pleasure for me, Excellencies, honourable ministers, colleagues, friends, because I was a family doctor for many years and I still have a very strong emotional and professional connection with family medicine. But I've been asked to say a few words about linkages between climate change and conflict, because as we've already heard, we're in a polycrisis and there are multiple crises going on simultaneously. And one of the important ones is climate change, as well as, of course, the crisis of increasing conflict and militarism around the world. So what are the linkages between those two processes? And I want to show, if I can, show a few slides just to illustrate those. So, the first slide just shows you the extraordinary changes we're seeing in the world's climate. So unfortunately, we're going to breach the limits of the Paris Agreement, 1.5 degrees. We're pretty well there already. It's very unlikely we're going to go down. If we're lucky, we can still keep below 2 degrees. And that's a global average. And of course, the land is heating up much faster than the oceans, and some parts of our planet are heating up faster than others. And that's having major implications for human health. I don't have time to go into all of them, but it's obviously affecting heat deaths, infectious diseases, nutrition, population displacement, wildfires, emergencies, and so on. So what are the interlinkages between climate change and conflict? Well, of course, climate change has multiple impacts. It has impacts on the economy. It makes markets volatile, increases prices. It also reduces access to key resources, degrades the environment, accelerates pollution. and also, of course, increases poverty and inequality. And all of that feeds into the drivers of conflict and results in increased risk of tensions and military confrontations, of course. So what is the empirical evidence? I don't have time to go into detail, but I did want to just show this one slide. It's quite a famous study, actually, done a few years ago, where they did a big review of all the literature for many, many decades, and they showed these relationships between conflict risk and temperature across different parts of the world. And I won't go into detail, but suffice it to say, they found strong links between increasing temperatures and different types of conflicts and different types of interpersonal violence. And that triggered a lot of interest in the research community about how that actually happened and where this violence was particularly occurring. And you can see, for example, sub-Saharan Africa was very much a focus of that violence in this analysis. And we now know, thanks to subsequent research, that drought, for example, which is accelerated by climate change, can contribute to sustaining conflict, particularly for those agriculturally dependent groups where they're subsistence farmers, dependents on their crops, and politically excluded groups in very poor countries. And you can see the relationship there between conflict and agricultural dependence and the interrelationship with drought, which of course is one of the sequelae of climate change. So we know that fragile and conflict situations increase climate vulnerability and they impede adaptation, because we have to try to adapt to the climate change that we cannot prevent. We know that hunger due to conflict nearly doubled over a recent 5-year period. 75% of acutely food insecure people live in fragile and conflict-afflicted states. And many of the countries most vulnerable to climate impacts, of course, are fragile and conflict states, affected states. Sadly, we also know that adaptation funding, international funding for adaptation to climate change is lower in these states. The states that most need it get the least funding. And that's because people don't have confidence it's going to be spent well. But I would like to counter that and say that it is doubly important to invest in these countries. And we also know that women's and children's mortality from non-violent causes, not just from violence, increases substantially within 50 kilometers of conflict. And that's because of the erosion of healthcare systems. We also know that rising military spending is diverting resources just when we need them for climate change and for public health. They're being diverted into military expenditure. And this graph shows you the extraordinary increase that's occurred. It's nearly $3 trillion a year we're spending now on preparations for war. And this famous quote by Dwight Eisenhower, who was a military leader himself, who'd seen the tragic effects of conflict, emphasizes the effect that every gun that's made is a theft from those who hunger and who are not fed, etc. So a powerful comment by a military leader. So I would argue that in financing increasing militarism, we are taking away funding from climate change and from health, public health more generally. And it's, I think, maybe it's a coincidence, but it's extraordinary to see that about the same amount that we're spending on militarism is exactly what's required to address climate goals. So if we could divert even a proportion of that funding into the real security threats that are confronting us, then we could tackle some of these issues. And I would argue again that we mustn't give up on the most climate affected countries. We should actually be focusing climate adaptation funding on that. But that means we can't do that in a top-down way. We need to work with the affected communities because they know how to deliver care in these very difficult situations. And I also conclude by saying that militarism is also driving the climate crisis. So about 5 to 6% of the greenhouse gas emissions are coming from the military. And that's an underassessment because it doesn't actually include the actual emissions coming from the conflict itself. So if the military was a country, it would be the 4th largest emitter in the world, higher than the healthcare system, by the way. And of course, there's no obligation to declare military greenhouse gas emissions under the Paris Agreement, and that should be rectified. So let me conclude. This final slide really is just a call for us to redefine security. We'll never achieve security if we just define it in military terms. Of course, there may be military threats, I'm not denying that, but you can't just define security as military, the military challenges facing us. And this slide just shows you how we've been eroding the actual natural systems on which our civilization ultimately depend. And this is you know, over the last 15 years or so, you can see how this has changed. In 2009, we only knew about 7 planetary boundaries. Now it is thought there are 9 of these, including climate change, biodiversity loss, freshwater depletion, and so on. And 7 of these boundaries have already been crossed. And so that is eroding and undermining the progress of human civilization. We can't avoid addressing that. And so I believe that we need to redefine security in this new era that we're living in. And that means safeguarding human health within planetary boundaries. And I'll just conclude by saying that I'm very pleased and proud to say that WONCA is playing an important role in that, because through its environmental working group, many family doctors around the world are integrating planetary health in their day-to-day work, promoting peace, but also promoting safeguarding health within these planetary boundaries. Thank you very much.
Thank you so much. And thank you also for that shout out to the Working Party on Planetary Health. We really appreciate that. And for all of this information that you're hearing today, we would love to hear some questions and hear some thoughts and responses from our audience here. So I'm going to give you a few moments to gather your thoughts and think about what you may want to ask. And as you do that, I'll share a few thoughts that I've thought of as we try and pull some of this together. We've heard that health and peace are interconnected, and that health systems really foster trust, inclusion, and social cohesion. We've heard that promoting health and mental well-being can reduce polarization and support peace building, and that primary care and public health are essential for equity, solidarity, and protecting vulnerable populations during conflict. Healthcare workers, civilians, and health facilities must be protected at all times, and that priorities include strengthening health systems, expanding collaboration, building capacity, and advancing health diplomacy. We know that mental health, rehabilitation, disease control, and addressing social determinants of health are key to resilience and recovery, and that you've heard multiple say that we have to have multilateralism. We cannot move away from that, that we need to commit to human rights and to democracy, and the principle that there can be no health without peace and no peace without health. So the stories that you've heard from the consultation room, recognizing our shared humanity, and that all of these require solidarity, you know, that we're building bridges, not walls, and that health can be a pathway to peace. I love what you said, Bettina, about peace is not only the work of diplomats or politicians, but it's all of us together working together, and that true global peace begins in the human heart with compassion, service, and care, and that a community divided cannot have health equity. And then we think about the complex interlinkages between climate change and conflict. Thank you so much for mentioning. And we always think about it, we know, but then to see it, to see the amount of money that's been spent on war and conflict when it should be on other things that are facing our world. How do we really redefine security? Thank you for helping us. So I'm going to open the floor now to questions. If you have questions, please raise your hand. Dr. Pilar Astier.
So Pilar Astier, a family frontline doctor in Spain and World Organization Family Doctors President-elect. Thank you to the panel for your deep commitment to advancing health and peace, and for bringing such a strong sense of hope to the discussion. Under the WHO and Global Health and Peace Initiative, we mentioned health is recognized as a powerful entry point for social cohesion. So local facilities are often the first who witness the community fractures that disrupt daily life and act as the baseline triggers of conflicts. So what specific local actions can country take, particularly Brazil, and that is here, the representation of the health ministry, to address social determinants of health and peace, and fostering resilient communities that lay the groundwork for peaceful, sustainable societies worldwide? Thank you very much.
Thanks, Pilar. I will speak Portuguese again. So, o Brasil tem um sistema universal de saúde, e esse sistema universal de saúde, ele é muito baseado na atenção primária à saúde. Temos 54 mil equipes de saúde da família, todas vinculadas ao sistema público de saúde, contratadas diretamente pelo Sistema Único de Saúde, que estão presentes nos 5.571 municípios do país. Com isso, estimamos uma cobertura de 80% da população brasileira, com metas de crescimento dessa cobertura. E entendemos que essa resposta aos determinantes sociais da saúde passam pela atenção primária à saúde, porque as equipes de saúde da família conhecem muito bem suas comunidades, conhecem muito bem as famílias dessas comunidades, têm agentes comunitários de saúde. No Brasil, são mais de 280 mil agentes comunitários de saúde que conhecem bem cada família e também enfrentam situações de violência que são temas muito discutidos com as equipes de saúde da família. Então, discutir paz passa por iniciativas locais que no Brasil são muito bem representadas pela atenção primária à saúde. Obrigado.
Let me see. Oh, yeah. Okay, thank you very much. I'm Dr. Sultana Kanum, former Director Health Systems Development for WHO CRO. At the moment, I'm working with children in crisis and conflicts with two NGOs. One is in Malaysia, the Gitano, and another is in Bangladesh. And I heard someone mention that the Peace Initiative is also working in Bangladesh, the largest refugees coming from Myanmar. I trust we all know that in 2017, more than 1.2 million people ran for their life from the Rakhine state of Myanmar, the previously called Burmese, from the military aggressions of the atrocities towards the ethnic minorities. And they all are still now in Cox's Bazar area in Bangladesh, as they are not called refugees, they are called forcefully displaced population. So I had been involved with them since 2017. I'm a pediatrician and a public health worker. I learned my public health from London School of Hygiene and Tropical Medicine. I think my teacher is sitting there. And anyway, I'm just sharing one experience, and I'm so glad that I came to this meeting and I could really fall on to the Peace Initiative group. Now, what I do, I'm just coming from Rohingya refugee. From 5th till 17th, we had medical camps. Every 2 years, twice a year, we go for medical camps since 2017. It's 8 years now. The population has grown. Every day, 100 children are born. Every year, 36 children are born. And we go with medical camps with medical volunteers and sit in the camps and look as many women, children, boys, girls who we can get. And that also one time. Due to reduction of fund, a lot of the health centers had been closed. And so the coping strategy really fell on food supply and healthcare, which is a tragedy. But anyway, we try to go and do as much as we can. But as we say, the peace, bridging the gap or making a bridge between peace between local people and the refugees, when we went for 2 camps, the local population were not very happy that we are also seek health services. So if the refugee is getting help, what have we done? And so a hostility created.
Thank you. Thank you so much. I'm sorry to cut you off, but I'm mindful of the fact that we have limited time.
Yeah.
And we don't have a counter on here to say you have 60 seconds,
Okay.
which you've gone
Anyway,
over.
I just finish it to say now that all these, because what I'm very pleased to hear that the peace initiative is hacking. And my request will be that please do not forget those 1.2 million people. Thank you.
Thank you so much. Thank you. Over here.
Thank you very much. Parsifal Islas on behalf of the UNESCO Chair on Science Diplomacy and Medical Impact NGO. I'm very happy to hear about a conversation on health and peace in the World Health Assembly. And actually, I want to say that I think health for peace can also be an inspiration for multilateralism in our current times, the same way science diplomacy and science for peace had been an inspiration for multilateralism when the international system was created, actually the inclusion of the S within UNESCO. But I think health diplomacy and health for peace has some sort of advantage, which is that while science remains a little bit far from the heart of people, health is at the very heart of results for people. Let me tell you very briefly an anecdote. Our NGO develops humanitarian health aid in crisis zone. We were in the community of Cochuapa El Grande in the mountain of Guerrero, which is a zone that is triggered by conflict from organized crime in Mexico. The only way of delivering vaccination to this community was through community doctors from our organization that could list. So the idea that I want to say here is that health for peace, community doctors are also a way of how science comes into the communities. And then I want also to raise a question for the panelists, because I would be very interested to hear your comments on how can science diplomacy and health diplomacy partner together in our current times. Many thanks.
I give it a try. First of all, thank you for the question. I think that scientists are a worldwide privileged person because they have connections and international collaboration throughout their work. And I think because they are privileged, they are the first to contribute to multilateralism. I would turn it this way. Being a scientist myself, I feel very privileged to have so many friends in all places of the world. And I think I have to work for peace because I know how important our work together is. And I think if we talk about health diplomacy, it's about the same. And it's about the same. We have a very strong duty to involve ourselves into what we have experienced as a very, very important advantage for others as well. I hope I gave my views.
Thank you.
Sure. My name is Hani Al-Qadi. I'm from the Sultanate of Oman. I'm a trauma surgeon. I've had the privilege to also work in Gaza for 5 weeks as a surgeon. And I've seen the collapse of everything there. And the only thing that was keeping Gaza alive was the health care workers. So I just want to congratulate whoever works in the field of healthcare and tell them how important what they're doing is, because that was the only thing that was keeping people alive. My question is to Professor Andrew Haynes. When you talk about militarism versus advocating for climate change resources, it's very unequal comparison in terms of like David and Goliath. You know, like, how do we go about bridging this big disparity in resources for military versus healthcare as climate change?
Well, thanks. Yeah, this is a really important question. And of course, it's not easy to answer because we're not actually being very effective at doing it. But what I would say is I think the health professions have a very important role in pointing this out, because we are in a position to comment in a dispassionate and scientific way about how resources are being diverted away from health and environmental protection. So I think this is a really important part of the work of public health professionals, but also health professionals more generally. And you as a trauma surgeon, for example, have a great deal of authority when you speak out about what you see, what you've actually witnessed as a trauma surgeon, and the limited resources going into the response compared to the amounts of money that are going into supporting arms. That carries a lot of weight with people. And I think communicating that to the general public and to the leaders of our profession and to political leaders is a really important role of health professionals, whether they be public health, surgeons, family doctors, whatever. We all have a role, I think, to play in that. So I think your voice is very powerful. And I think all power to you.
Thank you.
Thank you very much. Oh, yeah, please, sorry. Sorry, I should go? Yeah. Thank you very much. My name is Dr. Bronwyn King. I'm a public health expert, and it's been a great pleasure to be here and listen to your excellent comments. All week here, we've been hearing about the breakdown of multilateralism, the global health architecture, and a long list of genuine problems and challenges that we all face. But here on the ground in Geneva this week, in the conference rooms, the hallways, the hotels, the cafes, I've just seen energy and commitment and positivity and ideas and people renewing connections and making new relationships and announcing new partnerships. I've seen good spirit, a lot of listening, a lot of learning, a desire for better, for equity, for health, and for peace. And I see trust everywhere. Everyone's questioning, who can you trust? But I trust the people here. And so my question is, how can we together change the narrative that's out there in the media from one that is focused almost exclusively on the doom and gloom to one that highlights these renewed efforts and innovations and hope? Thank you.
Thank you so much for your comment. As president of WONCA, traveling around the world, I see a similar situation. I see people whose countries, whose governments are at war with each other, loving each other and talking and connecting and in ways that are just so meaningful. If we could rise up from these spaces to talk, to call for a real stop and a call for peace, it will be so meaningful, because what we're seeing here, we're seeing at so many other health professionals conferences as well. Yeah.
Thank you, Chair. First of all, congratulations for this draft resolution, and obviously it's a new big beginning. I have a very specific question. Myself, Amitav Shorkar from the UN Research. While, I mean, this is an unprecedented WHA, perhaps that so far we have experienced 7 votings, including both in committee and B. Perhaps what we often argue for, that it's not only a WHO technical agency, it's also a political entity. In that way, it is moving there. Now, the point is that, say, World Bank has this humanitarian peace development nexus, whereas this peace is more or less blind in that way. So far, it's not that one. Now, obviously, this is a new resolution, and there will be a programmatic approach in the coming years. Is there, how is it, I mean, first of all, is there any possibility to evolve this from this to go for larger human rights concerns, like whether this can be also a part of the, I mean, creating the accountability, the compliance structure for the Human Rights Council, for the UN General Assembly? Why am I saying so? So just say, think of that, if in any of the FCS, if the government is party to a civilian conflict, then the regions held by the opposition, obviously, I mean, it's very difficult for the World Bank or any funding agency to maneuver in that way. So how, whether will there be any possibility to make an accountability structure overall within the UN system? Thank you.
I can take this one. I need to unpack a bit because there are quite a few elements in your question. One is how health and peace and conflict interact, especially in those places where the government may be part of the conflict and several groups which are not necessarily the natural clients of the UN can be involved. That's what we do in practice in all of these places. We interact with both the government and non-state armed groups around a specific health topic, which is so technical and has so much bearing on the populations that they administer, that both groups are in agreement that yes, WHO, you need to get in there and you need to tackle this multi-drug resistant TB, this polio issue, this anthrax issue, this Ebola issue that is there. That's what we are living now, for instance, in the DRC with the Ebola outbreak. So that's one part, the practical part of your question. The second part is more political in terms of the consensus that Switzerland and Oman managed to get in the World Health Assembly around the fact that it's an important program for WHO, how and if it should be moved towards other organs of the UN as the GA, the Peacebuilding Commission, or the Security Council. It's a question to ask state, because there is always a danger when you move beyond the technical, which is what we are, WHO, to the political. And the political may pervade the health, which is the entry point, neutral and powerful that we have into peace. But the two are not exclusively, are not exclusive of each other. And we had in 2016, what is called the Sustaining Peace Resolutions of the Security Council and the GA, which were about mandating all of the agencies of the UN system for doing something to peace. So in a way, you can see the efforts of Switzerland and Oman at the World Health Assembly as a follow-on to the Sustaining Peace Resolutions, which were asking all of the institutions to move in that direction. And for the Human Rights Council, we have Slovenia in the room, who is a member of the council, better placed than me to answer this question.
Okay. 15 seconds. Okay. Thank you very much for the fascinating panel. I have 3 points to raise. There's no question. The first thing is good governance has 2 dimensions. And when we talk about peace, most of the time we talk about negative peace, which is a war and things. Sir Andy Haynes mentioned about the climate change and how climate change can lead to crisis and war. So something which is about positive peace, institutionalization, good governance is something that we are almost forgetting to discuss. And I haven't seen anything in particular in terms of that. The second thing, the Global Health Peace Initiative, just mentioned by Oman, is a very fascinating masterpiece. to somehow, it has 6 dimensions. And I haven't seen that we go to the details of that, what is needed when a compromise of peace happens. So I encourage every one of us to have a look at that and see how important that document is. And my last point is when war happens, when peace is compromised, again, coming from a country who has been in war, myself, I have seen that we don't think about the integration of services. Yesterday, I was privileged to attend the launch of the global, humanitarian actions by the Hopkins Lancet Commission by Hopkins. And 2 things were there. One was localization and listening to the community and people on the ground. And the second thing is prioritizing people in most need, like disabled people, children, elderly, and other things. So we haven't spoken about those kind of things in details, and we need to do that. Unless we cover those areas, I think this is not walking the talk, and we need to move forward. Thank you.
And everyone, I'm from Myanmar, and who is escaping the violence against healthcare from out of the. I've escaped for full time out of the 2000 incident of healthcare in Myanmar. So we have provided the care under since the military coup in Myanmar, and we have been care is delivered and displacement camp, private home and clinic, and also with the limited or no salaries and legal protection or no formal recognition sustained by professional duty and deep community or trust. We have the protection of the health worker in our country in Myanmar goes beyond statement of principle of the global health for peace initiative. It requires a long-time diplomatic engagement, accountability for attack on healthcare and organization of the clinician working outside the formal system. Myanmar should, for this state, and when those protections are fragile or uneven. And our 5 years of military coup, Myanmar healthcare workers are still standing, and also encourage the international community to stand alongside our people in Myanmar. Thank you.
I'm too short to press the button. At this time, I'd just like to say thank you to all of you, and especially for our sponsors here. Thank you, Brazil, to Spain, to Slovenia, and to Oman, and to many who are here in the room. I thank WONCA and also the World Federation of Public Health Associations. Thank you so much. For all of us who are thinking how health and peace are deeply interconnected, right? And the importance of fostering trusted relationships during times of conflict. It reminds us of our shared ohana, our collective family, where no one is left behind or forgotten, and where health and dignity for all, especially the most vulnerable, are safeguarded. I thank you for being here, and I invite you to come be with us with our cocktail hour. Thank you so much, Felipe, for the sponsorship, for our time together. And let's continue the conversation. Let's continue towards global peace. Thank you.